Hello everyone and welcome back to our channel Quaint. Have you ever wondered what happens if menstrual blood flows in the wrong direction? Sounds strange, right? But this backward flow called retrograde menstruation could be more common and impactful than you think. In a typical menstrual cycle, what happens? The lining of the uterus, known as endometrium, that sits and exits through the vagina, that is known to you. But in case of retrograde menstruation, the menstrual blood doesn't come out through the vagina. In spite of that, actually not all the blood, some of the menstrual blood goes in the backward direction through the fallopian tubes into the pelvic cavity. And with menstrual blood, one more thing remains present, and that is what? That is live endometrial cells. And those live endometrial cells implant themselves on the ovaries, then fallopian tubes, then the lining of the pelvic cavity. They implant themselves. And during monthly hormonal cycle, growth of those endometrial tissue, okay, actually misplaced endometrial tissue. So growth occurs, then breaking down occurs, then again bleeding occurs. And there is actually no space for that blood to flow. Okay, during menstrual cycle, all these things happen. And in not all the cases, this backward flow or the retrograde menstruation causes problem. Not in all the cases, but in some cases, they may cause problems. Means complications can begin in some cases, not in all the cases. So, what are the causes of retrograde menstruation? But just first of all, I should tell you that according to the researchers, most of the women at some point of in time, they must face this problem, though in most of the cases, this thing happens unknowingly. Because if there are no complications, then normally people do not notice this thing. But at some point of time, most of the women goes through this kind of menstruation, means where backward flow occurs. Anyway, what are the causes? First of all, I should tell you that this problem is still not well understood. Research is ongoing, but still this is not well understood. Anyway, what are the causes? Causes are uterine contractions, pushing the blood in the reverse direction. Then blocked cervix, that may be a problem, that may be a cause, not problem, that may be a cause. Okay, blocked cervix. So then again genetic predisposition, hormonal imbalances. So these are the reasons behind this retrograde menstruation. And normally, if complications are not there, so in that case it is very difficult to diagnose. But if complications like, since there is no space for the blood to flow, okay, so in some cases you may see complications like chronic pelvic pain, then painful periods, then pain during sex, then in some cases infertility. So if these are the problems, then in that case there is a chance of that the woman is suffering from endometriosis. Endometriosis, this is a problem. Okay, this is a medical condition, endometriosis. So if those symptoms are present, like pain during sex, then painful periods, then chronic pelvic pain, infertility. So in normal cases, it is very hard to diagnose this problem, but if complications are there, in that case normally doctors perform ultrasound, then pelvic exams, then laparoscopy. It is laparoscopy, it is a minimally invasive surgical procedure. Laparoscopy. And if doctors find that endometriosis is occurring, is happening just due to that retrograde menstruation, in that case, normally doctors recommend pain management like using NSAIDs, then hormonal therapy, just like birth control pills, to regulate or stop menstruation. Then lifestyle changes like anti-inflammatory diets, regular exercise, etc. Anyway, and just keeping your mind one thing, that all the women suffering from this retrograde menstruation does not don't show the symptoms of endometriosis. Okay, and again, if you talk about just the reverse case, means the women suffering from endometriosis, that doesn't mean that all that women are suffering from the same problem or showing the same symptom of retrograde menstruation, not inspection, menstruation. Okay. Okay. That means endometriosis is present, but maybe retrograde menstruation is not present. Again, maybe retrograde menstruation is present, but endometriosis is not present. Maybe both are present simultaneously. And if both are absent, then that's very good. Anyway, this problem is still not well understood. Okay, or better to say, is not fully understood till now. So this was all about today's topic. Okay, normally, so according to researchers, I have already mentioned that most of the women at some point in time, they face this problem, but unknowingly, means unconsciously, they don't even know that in her body this thing is happening, means retrograde menstruation is happening. Okay, until it causes any problem. Because when problems are there, then only women visit doctors, and in that case everything can be diagnosed and known, and accordingly they prescribe treatments. Anyway, so this was all about today's topic, retrograde menstruation. Okay. Anyway, so if you found this video helpful, so please like, share and subscribe to our channel. This is the end of this video. Thanks for watching.